Good morning. Today we'll be talking about the psychology of addiction and really trying to figure out why do we crave things we shouldn't. Thank you, Dr. Abiri and Dr. Dokun Adedeji, for coming on the program. It's a pleasure to have both of you here with us today.
Thank you very much.
Thank you for having me.
So, Dr. Abiri, if I can just start with you. What is addiction? How is it different from just liking something?
All right. So addiction is often viewed as a derogatory term, especially because of the way that people look at it. And so more often than not, in professional terms, people would like to refer to addiction as dependence. However, addiction in the sense that we all know it is a complex condition where an individual becomes dependent on either a substance, a behavior, or both. And what happens at the end of the day is that it leads to negative consequences, not just in their own lives, but in the lives of others. Now, there are a couple of factors that need to be, or criteria that need to be met for an individual to say that they have become addicted. And it would include a persistent compulsion to engage in that behavior or use the substance, even when the individual knows that it harms them mentally, physically, or socially. In addition to that, the individual who is addicted experiences craving, a loss of control, an inability to control themselves around the substance, and they also have withdrawal symptoms as well, even when they try to stop. Of course, what also happens is that this attitude or this habit is something that they continue to pursue, despite the fact that it causes a lot of damage to their own lives, to family relationships, to their marriages, to relationships with their children, to their jobs. And more often than not, we also find that these individuals may also get into conflict or trouble with the law, either because they've borrowed money from someone or they've sold something that is. That is addiction. If you wanted to look at the difference between addiction and liking something a lot, when someone likes something a lot, it's a more moderate and controlled experience. When you like something, you enjoy it, you have a strong preference for it, but you can still stop when needed without a significant emotional or physical discomfort. Now, liking something rather doesn't come with compulsions or negative consequences or behavior as it does with addiction. So again, if you had to look at what the difference is, addiction is compulsive, uncontrollable behavior of substance that harms an individual. While if you like something a lot, you just have a strong enjoyment or preference, but you're able to control yourself without any negative consequences.
Yeah, thank you. And now people say that where we are all secretly addicted to something. And so really, what I'd like you to just, by yourselves to look at it, because they call so many things addictions. Is it addiction to cocaine? Is it addiction to alcohol? Is it addiction to sex? Is it addiction to pornography? Is it addiction to shopping? Some people go shoplifting. Is it addiction to food, overeating? Is it addiction to sugar? Is it addiction to coffee? So there's just so many. How do we distinguish between these different forms of addiction? Are some, worse than others? How do we, how can we, is there a way to classify it?
Well, so if you notice when you were speaking or asking the question, you said something. Some are substances, cocaine, marijuana, heroin, alcohol, even caffeine. Some people dismiss things like alcohol and caffeine because they're quite, they're easily accessible, they're available, they're affordable, and the law doesn't, they're legal substances. But of course, they can also be misused. The other things, of course, that you've said, like sex, like eating, like gambling, like pornography, are behavioral, things that people indulge in. And so whether it is a substance or it is a behavior, the honest truth is that the individual becomes unable to control themselves around these things. It starts insidiously, usually as an experimental act, but over time, there's a lot of changes that goes on within the brain, which I'm hopeful that we will still talk about today. And as the brain starts to get rewired, as the individual starts to learn this behavior, as the individual gets some feel-good feelings, and yes, we shouldn't lie about the fact that every once in a while they feel good, but these are just transient or temporary feelings that after a while leave you, worse than you started off in the first place.
I don't know whether you like me to come in a bit.
Yeah.
I like what Dr. Abri has said, and I think also will help us in the treatment and management. You see, the connotation of addiction has been something out of the ordinary. It makes people, it gets people stigmatized. They then think that they're doing something that's so terribly wrong, so they don't own up to seek for management. And so that's why I would prefer dependence. But today, if you talk about dependence, people, they don't see the seriousness as when you call it addiction. Whereas when you call it addiction, it then stigmatizes and then it makes them draw away. And I think one of the things that she also said, you see, we found out that this dependence, whether behavioral or substance, is mediated in the brain because of the neurophysiological changes that goes on, and then that causes some people to get addicted to it. It's, again, as you said, we all have one thing or the other that we like. But it is likely that the behavioral things are considered as a bit of likeness, that because it is not dangerous to the individual in terms of physical, nobody talks about it. But substance, because you can say. But again, I think the important that I like what we're doing is raising the awareness in the society. It's so critical. Dr. Abiri said something that I like to happen. We say caffeine, oh, no, not a problem. Alcohol, not a problem. When the UNO did the statistics in 2017, they excluded alcohol because it is socially acceptable. When you drink alcohol, nobody blames you for drinking alcohol. But it is when it becomes terrible, the situation becomes bad, and the person begins to fall off his bike, go off job, and then we begin to worry about it. But it is the most dangerous addiction in the world. I'm sure we'll get to it. In the sense that what it does, it completely touches every organ of the body, whether from the skin or the brain or whatever. And so that's also, we must have this issue of alcohol. The danger in the world is there because of the economic viability of alcohol. Even the international organizations are very careful to label it as part of the dangerous substances. But again, I think the direction we're going will bring out more of the things we're talking about and give us a better understanding.
It's really important. Another one, as you were speaking, we haven't talked about is even smoking, because when you spoke about organ damage,
it's also socially acceptable. Smoking is socially acceptable.
Well, some places it's not socially acceptable anymore. It's becoming less.
Dr. You must know that because of the awareness created. When we were traveling many years ago, they say stay in non-smoking section, smoking. But everybody began to say that the smoke we waft to where no smoking is.
Exactly.
I think it's in New Zealand now or Scotland. You can't smoke anywhere outside. I think by next year, be criminal. You can be charged for smoking outside. Today people can leave the office and smoke outside, but they forget, as we are beginning to let people understand, passive smoking is even more dangerous than probably active smoking. And so that's why I like what you've been doing all these years about this thing. The more awareness we raise. Look, Dr. Abiri will tell you, even with this talk about substance use, the rate of use is just frightening. So frightening that we would need to worry. When people as young as 8 are beginning to use this thing. And so, anyway, we'll get to it. Just let's go on. It's just frightening.
Yeah. It is. Dr. Abiri.
Please.
Now, there's just, we've touched on a lot of areas. But what about, I think we should just follow the flow of what Dr. Dokun was speaking about. And, we were talking about illegal substances. Yes. We've talked a bit about alcohol. We've talked a bit about some of these other things. But in terms of illegal substances, illegal drugs, so we're talking about, obviously, you'll tell us a bit more about some of them, later. But how about the legal drugs? We're talking about opioids, for example, Valium, for example. There's some drugs that are being given to people that have some of those strong addictive properties. Lexotan, one of the commonest drugs prescribed.
Yes. So, well, if I were to lend my voice to that, it's interesting. Yesterday, I sat with, an old woman who was telling me about the experience that her husband, who had been placed by doctors in a hospital on opioids for over 2 years. And then all of a sudden, he went into, he was constipated. He couldn't use the toilet. and they found out that the opioid was the offending agent. And the moment they decided to remove that drug, the man became a monster. The withdrawal symptoms started. He started screaming. It became uncontrollable. It had to be physically and chemically restrained. So yes, you're very right. When we talk about, yes, they're prescription medications, but clearly some people go ahead to abuse them. And it's painful because the abuse is not just by the man on the streets. It's not just it's by even health professionals, doctors like you and I. Sometimes you even find people who have no idea of where a vein is, how to use a needle, who are constantly injecting. And so when Dr. Dokun had said it earlier that unfortunately, in spite of the awareness that we even think that we're creating, there's such a lot going on. You have things like the date rape drug. You have things like, even ketamine. Ketamine, and those were the things that we read in books. When we, heard of the celebrity who died a few years ago of propofol, we read it in books. We learned about it in medical school. Maybe some anesthetists worked with it. But in Nigeria, you'd be shocked that there are some drugs that even doctors are looking for that they can't find, that a lot of our patients have access to. And quite a number of people, including professionals, are actually trafficking these drugs and selling it to the highest bidders. So there's a lot going on, unfortunately.
Wow, we really have to talk more about it. Thank you very much. Now, Dr. Abiri, a question that came through during the break is, how does a person know that they are addicted? Because we've talked about these normal substances, be it caffeine, coffee, be it, even the example used was sex. There's so many, unfortunately, so many things promoting sex, saying, oh, have sex how many times a day, how many times a week, how many times. So by the time you start practicing things you've heard, and then at what point do you become addicted? And how can people who are listening determine to themselves whether they're addicted or not?
Right. So when we started, we talked about liking it and being, addicted to something. But usually I would say that when it becomes a disorder, how do you know it has become a disorder? When the symptoms start to increase in intensity, in frequency, and the distress that it causes, not just to the individual, but to people around the individual. So what do I mean by that? People start to use drugs, alcohol, other substances, or engage in that behavior much more than they usually would. It starts to interfere with their lives. So if they were working, they won't be able to be as productive as they were at work. If they were schooling, they will struggle with school. They would struggle with relationships and will continue to use that substance despite continued problems with their relationships as well. And then, of course, we also find that they would start to give up or reduce activities that they would previously enjoy because of the substance or the behavior. And last but not the least is there's an increased risk appetite. They start taking risks that ordinarily they will not be able to take. So they may start to borrow money. They may start to engage in, risky sexual behavior or even aggressive behavior or increased aggressive tendencies. So when the symptoms start to increase in intensity, frequency, and start to cause distress to not just the individual, but to the people and the things around them and their lives, then we have a disorder and it has become a problem.
And that's when they need to seek help.
Well, I wouldn't advise that they wait till that point. They should have started seeking help at the moment that they notice.
I said, is this issue of normal drugs, everyday drugs, or not so everyday drugs, but prescribed drugs, that those prescribed drugs become an addiction. Now, the issue here is, how do when a doctor gives you a prescription, a lot of people say, the doctor gave it to me, and they continue taking it. How do they pick which kind of drugs they should be careful about? Maybe the doctor has given you a prescription, and he has not forgotten, renewing your prescription because you say the thing is still hurting or whatever. You'd also be aware that these are drugs you can get addicted to, and actually consciously down your own use of these drugs. That's on the one hand. And on the other hand, the drugs that are now health personnel are getting addicted to. How is it happening and why? So take it away, Dr. Abiri.
Right. So I think it's interesting that there's a lot more focus these days on healthcare professionals who are either giving medications to patients and forgetting them on it, Or when patients even finish the prescription that the doctor has asked, but go to a pharmacy and are able to spend as much money as they need to procure the medication against the doctor's orders without a prescription. And then, of course, we must also start to talk about how, as healthcare professionals, some of us are enabling patients to get medications that they otherwise should not have access to. I mean, you probably remember the case of Matthew Perry, which I guess is still in court, where, Matthew Perry was given quite a number of prescription medications by healthcare professionals. And this is fast becoming the order of the day. I know it's not something that we're talking about that much, but we're beginning to have healthcare professionals who have access, who have the means, who are using these substances, and sometimes, even stealing them from the hospitals just because they're trying to make themselves feel good. Sometimes it is because they have an underlying health condition. Sometimes it could be a physical health condition, sickle cell disease. It could be a mental health condition, depression. It could even be, the heartache from being in a domestic violence relationship. But I think it is extremely important as healthcare professionals that we must take responsibility for our actions, understand that there are ethical and legal boundaries that we must not cross, and ensure that even when we give patients prescription medications, we should be on alert and remember to take them off the medications, especially when they should be off the medications.
Dr. Dokun?
Right. Thank you, Dr. Abiri. There's something I think this program is going to help. I think health professionals must come to an understanding that there's one thing to be a medical doctor. There's another thing about having an understanding about what we're discussing. Because doctors usually sometimes can be proud, learning from other people until they learn from experience. She just gave I think there was a Nigerian doctor that just been arrested. I can't remember whether in the US, who was using his position to get the drugs and then to supply and get paid for it. It was given to patients. Nigeria is even worse because anybody can walk into a pharmacy and buy any drug at all. I mean, I've seen a young man who, to me, the morning he came to me, had taken 8 ampoules of injection pentazocine. And that's so you can imagine. And his father is a medical doctor. His brother is a doctor. So he gets this thing. And then people can walk into pharmacy and buy. And they keep that prescription and they keep buying. And you see, one of the things that also we spoke about, yes, you may tell your patient, but one of the ways to do it without letting them know you are taking them off is to take down the prescription. Maybe if you say take 1-3 times a day, it becomes one twice a day, once a day, one alternate day. So the patient does not feel this urge, the craving to go and get it. The world today, nobody likes pain. So because the pain is virtually in everything, in post-surgery, sickle cell and all the rest. So people, I know what we found out is the pains they now complain about, phantom pain. They're not really the pains associated with whatever they had initially. So it's so important that we raise the awareness. I don't know how we're going to do it. I must tell you, Pamela, it breaks my heart to see that NDLEA has decided that to run another survey. The only survey we have is 2017. And that is old. If you now know the range of use. So we need to have our own local and domestic survey. We don't want to do, but that's going to cost a lot of money. I don't know how they want to do. This awareness, look, one of the things I wrote a paper and I sent it to government about declaring a state of emergency on substance. Sierra Leone did it last year and they're getting resolved. If we don't tackle this in that manner, it will be an epidemic.
Can you tell us
about
this state of alert?
Oh, you see? No. Yeah, because look, if we don't raise this issue, I mean, you are the only person that I've seen as a doctor in the last 5 years or thereabout or 10 that been talking about this issue. You don't see it until World Drugs Day. It's only then people will be pursuing you to come and talk about the dangers of drugs. And I said to them, that is tokenism. That is a waste of my time. What happens in the 364 days that we don't talk about? So it's, I don't know. It's heartbreaking.
It's heartbreaking. And I understand now there are even more drugs available. There seems as if the cascade of illegal substances is never ending.
No. It's not ending. Look, Victor talked about one when we were on break about, they call it red. If you see what it does to people, you know, in Nigeria, we manufacture crystal meth.
Mm.
And so all these drugs are that locally concocted. There's a native vegetable called gegemu that people use. And these are naturally occurring substances. How can you, I mean, the one in Sierra Leone is called kush. They go to burial ground, they get bones, and then, you know, so because of the fact that people need to get higher, so they get something concocted to give them that. So I don't think we can stop the proliferation, but I think we can help people make informed decisions as to what to do and what not to do. That should be the basis of awareness and the focus on getting, particularly young people. When you now, you know, when this lady in NAFDA said they should ban sachet drink, the House of Assembly and National Assembly said, oh, you want to take job. The woman is not saying ban alcohol. She's saying ban sachet. If you look at those sachet drinks, Pamela, if you look at some that they call bitter, they have 42% alcohol.
42.
And they call 42. Go check them. I can get you some of them when I see you. 42%. I don't want to mention the name. I know one that is 42, that is 140. The lowest of them, they are 17.5% alcohol. No sachet. So you can then imagine when little kids buy it for 50 naira. The availability is there. You know. So it's I don't know. It sometimes it's depressing, but we'll keep at it.
Depressing, but I think this call for you know, increased awareness is there. Unfortunately, you won't believe the program is actually over time is actually run out. So if we can have some last words for our listeners. Dr. Abiri?
Well, so I usually when I have to talk about substance abuse, I often say that once you pop, you can't stop, even though that's a popular slogan from something that's, you know, is popular. But don't start. Curiosity kills the cat.
Yeah.
And, you know, unfortunately, these days, there's so many things that people don't even know what they're taking. You know, when I sit with patients and they're telling me, oh, I trust my plug, I trust my dealer, even that in itself is a problem of judgment. There's a judgment problem. How can you say you trust your dealer? Unfortunately, many things are not licensed around here. And so what mostly young people would often say to you is, oh, in Canada, it is, you know, it's legalized. But not in Nigeria. And especially because we have a control problem. I mean, we have so many problems that drugs will just worsen what is already going on. For me, avoid drugs. People will tell you that it does wonders. People will tell you that it can take you to the moon and bring you back. But please, don't start something that would take you on a journey that would, you know, make you feel miserable for the rest of your life. You would lose a lot. Don't do substances. You may struggle. And if you are doing substances, please acknowledge the problem, reach out for support. There are centers where you can get the help that you need, but you must first of all, of course, be willing.
Thank you. Dr. Dokun, your last words, please.
Mine is, I think a time has come in which we must now direct our awareness program to parents. There are too many parents who don't know what parenting means. And I say it anytime I go to talk that many parents need parenting because of the attitude to the upbringing of their giving them financial, whatever background, it does not help. The psychological support is required, is absent. Many of the times, these children don't need the money, the affluence we offer them. They just need you to be there. I said to many fathers, how many fathers go to the PTA of their children's school? They hardly go. They only provide the money and say, I've done my best. That's not. Anybody can provide for a child financially. But what about the psychological support? And I think a time has come in which our religious body should be more mandated and careful. They see a lot more people than Dr. Abiri and myself. How many people can we see? Many of the pastors don't even know about what they say, go to deliverance. So the thing is, this issue of awareness is so huge. And I think that's the way we should go, and then minimize the people introduction to drugs.
Thank you. I want to thank both of you for coming on this program. It's I don't think we can get to the end of it, but I think it's very important what you've shared, and I really appreciate it. Thank you very much.
Thank you.
you.
Thank you.
Thank you for watching. Please like, share, and subscribe for new video updates.